I'm Shelby Benoit.
My name is Veronica Campos.
I'm Brenda Carrillo.
I'm Barney Caporal, and our topic is HIV AIDS.
According to the Center for Disease Control and Prevention, also known as the CDC, every 9.5 minutes someone is infected with HIV. In recent years, new infections of HIV have increased in young adults ages 15 to 24, which also makes up the college-age population. It is important for college students to recognize the risk of developing HIV, so the aim of this presentation is to provide you with adequate knowledge about HIV and AIDS. What is HIV? HIV stands for Human Immunodeficiency Virus. HIV weakens the immune system by destroying T cells. T cells are responsible for helping the body to fight off disease and infection. Unfortunately, the immune system cannot fight off the HIV infection, so the virus continues to invade these cells and uses them to make more copies of themselves, making the virus stronger and stronger. When the virus becomes too strong, it turns into AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the final stage of HIV. A diagnosis of AIDS is made when a patient has one or more opportunistic infections, such as tuberculosis and pneumonia, certain cancers, such as primary central nervous system lymphoma and Kaposi sarcoma, and a T cell helper count or CD4 count of less than 200. Signs and symptoms. Many people who are HIV positive are asymptomatic, meaning that they do not experience any symptoms until they progress to AIDS. 1 in 5, or 20% of those with HIV do not know that they have HIV. Signs and symptoms vary depending on the individual and the stage of the condition. Some common side effects for early stage of HIV include fever, chills, night sweats, and oral ulcerations. In the latency period, the virus becomes less active in the body, and the patient will experience a decrease in symptoms, or they may become asymptomatic until they develop AIDS. In AIDS, common signs and symptoms include fatigue, diarrhea, nausea, vomiting, fever, chills, and wasting syndrome. Epidemiology. An estimated 56,000 individuals are infected with HIV in the United States each year. There are currently 1.1 million people living in the United States with HIV and AIDS, and 33.4 million people worldwide. Worldwide, HIV and AIDS have been responsible for 25 million deaths since 1981, and 617,000 of those deaths here in the United States as of 2008. So who does HIV affect? African Americans account for 44% of all new HIV infections in 2009, and 46% of those living with HIV. There has recently been an increase of new HIV cases among young people ages 15 to 24, but HIV and AIDS occurs in all age groups. There is a higher rate of HIV cases in men, and 61% of those cases occur in men who have sex with men. Domestically and internationally, HIV affects those of lower socioeconomic status at a higher rate, and this can be attributed due to lack of resources and riskier health behaviors. In this graph, you can see that African Americans are greatly affected by HIV more than their white and Hispanic counterparts. Also in this graph, you can see that men are more affected than women. In this graph, you can see that HIV and AIDS affects people of all age groups. In this picture of the United States, you can see the HIV and AIDS cases reported. HIV and AIDS cases are higher in Texas, California, Florida, and New York.
HIV and AIDS has primary and secondary risk factors. HIV is primarily spread by having unprotected sex without using a latex condom. Anal sex is more risky than vaginal sex. The risk also increases if a person has multiple sex partners. Having other STDs can also increase the risk of spreading HIV, mainly because many sexually transmitted infections produce open sores on the genitals. These sores act as doorways for HIV to enter the body. People who use intravenous drugs often share needles and syringes. This exposes them to droplets of other people's blood. HIV can also be passed from mother to child during pregnancy, birth, or breastfeeding. Less common modes of transmission include being stuck with an HIV-contaminated needle or other sharp object, receiving blood transfusions, blood products, or organ or tissue transplantations, that are contaminated with HIV. This risk is extremely remote due to the rigorous testing of the U.S. blood supply and donated organs or tissue. Contact between broken skin, wounds, or mucous membranes and HIV-infected blood or blood-contaminated body fluids is also rare. Tattooing or body piercings present a potential risk of HIV transmission, but no cases of HIV transmission from these activities have been documented. Only sterile equipment should be used for tattooing or body piercings. HIV can be prevented by abstaining from unsafe or unprotected sexual activity, limiting sexual partners, and by using condoms correctly and consistently. Latex condoms are highly effective at preventing transmission of HIV and other sexually transmitted diseases. Natural or lambskin condoms do not provide sufficient protection against HIV. Getting tested and treated for STDs will reduce the spread of HIV. Male circumcision has been shown to reduce the risk of HIV transmission from women to men during vaginal sex. Obtaining medical treatment immediately can prevent infection if they started quickly, as soon as a person thinks they have been exposed to HIV. This is called post-exposure prophylaxis. In detection of HIV and AIDS, the most commonly used HIV tests detect HIV antibodies. These are the substances the body creates in response to becoming infected with HIV. This can be done by testing the blood or saliva. Unfortunately, these types of HIV tests aren't accurate immediately after infection because it usually takes up to 12 weeks to develop these antibodies. There is a newer type of test that checks for HIV antigens, which is a protein produced by the virus immediately after infection. This test can confirm a diagnosis within days of infection. An earlier diagnosis may prompt people to take extra precautions to prevent transmission of the virus to others, and there's increasing evidence that early treatment may be of benefit. Other tests that can diagnose and determine the stage of the disease is a CD4 T-cell count of less than 200, a viral load test, and a drug resistance test. A healthy person will have a CD4 count of 500 to 1,000, whereas a person with HIV and AIDS will have a count of less than 200. The viral load test measures the amount of viruses in the blood. Studies have shown that people with higher viral loads generally fare more poorly than those with a lower viral load. Drug resistance blood tests determine whether the strain of HIV a person has will be resistant to certain anti-HIV medications and the ones that may work better.
Now to move on and talk about treatment. Remember, HIV and AIDS cannot be cured, but there is treatment available to help prolong and improve quality of life. The goals of treatment include decreasing the viral load, maintaining or raising the T-cell count, and delaying the onset of HIV-related symptoms and opportunistic infections. The main drug therapy for HIV infection is ART, which stands for Combination Antiretroviral Therapy. It was introduced in 1996 and consists of cocktails of 3 or more antiretroviral drugs used in combination. ART has significantly improved life expectancy to decades rather than months. Especially when therapy is started early and is used consistently, it can help prevent complications and transmission to others. ART therapy works by suppressing the HIV viral load in the blood and genital fluids. Consistent use has been shown to reduce the risk of transmitting HIV to an uninfected partner by 96%. It also can reduce the risk of perinatal transmission from about 25% to 8%. But also remember, prevention benefits are not 100%. Here are some examples of drugs used to treat HIV and AIDS. The major classes of drugs are reverse transcriptase inhibitors, protease inhibitors, fusion or entry inhibitors, and integrase inhibitors. Some side effects of these medications include nausea, vomiting or diarrhea, abnormal heartbeats, shortness of breath, skin rash, weakened bones, bone death, particularly in the hip joints. But despite these side effects, HIV treatment has evolved from a complicated regimen of numerous pills taken several times a day with severe side effects to a now possible once-daily pill with fewer side effects. Now to move on and talk about how HIV can affect you. It can affect you physically, emotionally, mentally, socially, and it can severely impact your daily life. Some ways HIV affects you physically include, but are not limited to, pain, fatigue, weight loss, delicate skin which can cause you to bruise easily, insomnia, and the side effects related to art therapy. HIV can also affect you emotionally. Some effects include anxiety, low self-esteem related to the AIDS diagnosis, depression, hopelessness, and denial. HIV can also affect you mentally by impairing your memory, and there is also an overwhelming amount of information that you have to learn about your medication regimen and the disease process. There is also the stress of decision-making. Socially, HIV can affect you by interrupting your life and family. It can cause you to isolate yourself. You may have to change behaviors and/or friends. The fatigue can cause you to stay away from activities you once enjoyed. There may be a loss of friends and family, and there are also negative social constructs associated with HIV. Your daily life can also be affected in many ways. You may need to relocate. You may have to get rid of pets. You may need help with self-care. You may have to alter your schedule for medication administration. And you may have to change jobs due to discrimination against you due to your HIV positive status. You may have to alter risk-prone behavior. And you may have a decreased life expectancy.
Spiritual and emotional support. Patients newly diagnosed with HIV may be in a state of shock or denial and unable to retain or understand information. These patients and their families may need counseling and support emotionally and spiritually. Intervention for spiritual distress. Respect others' belief and avoid imposing spiritual beliefs on others. Promote a sense of love, caring, and compassion. Listen to the person's feelings about suffering and/or death. Be non-judgmental and allow time for grieving. Discuss personal definitions of spiritual wellness. Ask about religious beliefs and practices, absolution, seeking connection, comfort, reassurance, healing, or searching for meaning or purposes. HIV/AIDS rehabilitation goal. Along with HIV/AIDS treatment, simple lifestyle remedies can fight disease progression and extend health longer. These remedies include eating healthy and fresh foods, avoiding raw and unpasteurized foods, getting annual and regular vaccinations, and being careful around animals. HIV/AIDS rehabilitation services. Despite exciting new developments in the treatment of HIV infection, patients eventually experience disease progression, disability, and death. Care during the terminal phase can be at home, in a healthcare facility, or through hospice, and care should focus on keeping the person comfortable, facilitating emotional and spiritual acceptance of life's finite nature, helping the person and family deal with grief and loss, and maintaining a safe environment. For more information regarding HIV testing or support groups, visit www.cdc.gov.
That concludes our presentation on HIV and AIDS. Hopefully, you have learned something that will help you and your loved ones stay HIV free. Thank you.